Hi, my name is Mackenzie Abramson, and I'm going to share with you my internship project that I worked on. And what I did is a Green Advantage Pre-Construction Risk Assessment Infection Control Risk Assessment Certification Program Evaluation. I know that is a mouthful, but basically we were just evaluating the effectiveness of a PCRA-ICRA program. In order to have a healthier and more equitable or resilient society, it requires the participation of all sectors, including the government, private industry, research, and institutions. So, Health in All Policies is an approach that creates the framework for an interdisciplinary practice and collaborative partnership that will address all the factors that influence social determinants of health, including education, transportation, housing, and safety. So, the Nevada Public Health Training Center, where my internship was housed, partnered with the Nevada Office of Minority Health and Equity and recognized the need to address health inequities throughout the state and determine a Health in All Policies initiative that should be explored and trialed. So, as part of that Health in All Policies, there were a section of pilot projects done, and my project was working with Green Advantage. Green Advantage is a US EPA grant funded green credentialing company for the construction industry. And in partnering with them, we were able to evaluate the effectiveness of a PCRA-ICRA certificate program. And Green Advantage's certificate program is the only American National Standards Institute accredited program, so it's one of a kind. The construction industry workers who were enrolled in the program were surveyed and assessed to demonstrate their pre-certificate knowledge and their post-certificate knowledge. So the methods for this project were pretty straightforward. We began with an action planning session where we developed SMART goals for what was going to be 6 months of a project, but eventually extended to 9 months. After that, we worked on the enrollment in the certification program, which was the survey population that we needed to target. And really, that included anybody in the construction industry that worked in any field. It could be drywall, sheet metal, anything that paid the registration fee and participated. So after that, we went on to data collection, where paired pre and post surveys were developed using SurveyMonkey to assess the participants' knowledge of PCRA-ICRA before the training and after the training. The questions were mostly formed in a Likert scale style with a few open-ended questions on the post survey to gather recommendations for moving forward and about the future of this training. Lastly, there was an evaluation done by a third party conducted by the Nevada Public Health Training Center. And this included kind of the Health in All Policies understanding, project relation to Health in All Policies, project successes, and personal evaluations of all parties involved, including the interns, the preceptor, and the partnering agency. So as far as the findings go, over the course of 9 months, we were a little limited, but had 53 complete responses to the pre-survey and 34 complete responses to the post-survey. Unfortunately, out of all the participants that completed both surveys, there were only 18 that did both the pre and post-survey. But we were still able to kind of gather important information on the success of the survey. So some of the key findings from the pre-survey were that when asked how a participant would rate their pre-construction risk assessment knowledge, 26% had no knowledge to start with, 32% basic knowledge, 23% intermediate knowledge, 17% advanced knowledge, and 2% indicated they were already an expert. And we asked the same question about the infection control risk assessment, and the numbers were fairly similar, with 24 had no knowledge, 28% had basic knowledge, 23 indicated intermediate knowledge, and 23 advanced knowledge, with 2% also indicating expert. To kind of compare that with what it looked like after they completed their training for the post survey, the participants were asked again to rate their knowledge, and no one ever said that they had no knowledge, because obviously they do now. And 18% indicated it was only basic knowledge, 24% indicated that it was intermediate knowledge, 50% indicated advanced knowledge now, which was a big jump, and then 9% indicated expert, which was another big jump. And the numbers again were similar for infection control as well. Along with the findings, one of the questions on the post survey asked participants who participated in Green Advantage's PCRA-ICRA training and other trainings to kind of compare the two based on 6 different categories. And as you can see here, there were some categories such as the ability to meet learning objectives and the convenience and the application to their work where Green Advantage was preferred. But there's one section that stands out where another training or other trainings were preferred, which is the clarity of concept. So this is something we can take and use in the future to work on clearly outlining the concepts of this training. As far as the research goes, there was quite a few limitations. We started this right in the middle of the COVID-19 pandemic, which posed all kinds of limitations of its own. But in terms of the project, the biggest limitation was probably the enrollment and small sample size, because we only really had 18 participants who completed both aspects of the survey, while more completed either one or the other. It's really important that they completed both. However, we could still get what we needed to measure the success of this training. Another limitation of this project was the cost, which also probably contributed to the small sample size. For a participant to take the training from Green Advantage, it is $499. And we know that throughout the pandemic, finances were tight. So this is something we attribute to being part of why our sample size was so small. And the final limitation of this project was that there was no access to other PCRA-ICRA trainings, and thus no comparison group on how to measure this training compared to the other one. We were only able to go off of the participants' information. So in conclusion, the Green Advantage PCRA-ICRA certificate training is a successful program in improving a knowledge of PCRA-ICRA best practices. The goal was to partner with Green Advantage and Nevada Office of Minority Health and Equity and the Nevada Public Health Training Center to evaluate the effectiveness of the PCRA-ICRA certificate program. And construction industry workers who were enrolled in the program were surveyed and assessed to demonstrate their pre-certificate and post-certificate confidence and knowledge while working in the healthcare construction, as well as the readiness to protect themselves and others from the increased risks and infection exposures. Participants who completed the survey demonstrated that they did gain knowledge and they did feel more prepared to continue with PCRA-ICRA best practices, and they even sometimes expressed wanting to expand even more so on these practices. So the Nevada Office of Minority Health and Equity should go forward in producing a statewide policy on PCRA-ICRA certification for healthcare construction, because having that certification is going to really just produce the best standards and the best procedures for healthcare construction. And then to wrap up, I just would like to acknowledge the people and organizations that helped with this. And that was Green Advantage, the Nevada Public Health Training Center, the University of Nevada, Reno, the Nevada Office of Minority Health and Equity, and the Western Regional Public Health Training Center. Thank you.